June Pediat Pediatrics webinar. So, my name is Jackie, and I am the co-lead of the webinar committee for Teens for Healthcare. And so I'm a freshman from New York City, and I go to Tottenville High School if you're interested. And I'm just going to introduce my other co-lead, Lakshmi, really quick, and she can introduce herself.
Hi, my name is Lakshmi. I'm going to be a senior next year. I live in New Jersey and I go to Mates.
Okay, so so today's webinar we have Dr. Yami as a guest speaker, and we're just going to let her present. She's a pediatrician, and she's here to talk about what she does and just all about pediatrics. And so we will she will introduce herself later on into the slides, but as of right now, we're just going to let Dr. Yami start when she's ready. So if everyone can please give a warm welcome to Dr. Yami. She is here to present the presentation that was made. And so Dr. Yami, you could present when you're ready.
Okay. Well, first, I just want to say hi to everybody. Happy Saturday. Hope that everybody is doing fantastic or plantastic today. And so I am a board certified pediatrician, but one of the things that Jackie and Lakshmi may not know is that I'm also board certified in lifestyle medicine, and I'm a national board certified health and wellness coach in addition to that. So I graduated from medical school with 3 degrees in addition, my Doctor of Osteopathic Medicine, Master of Public Health, and Master of Science. So I added that to the slides. Jackie and Lakshmi, thank you so much for doing the slides for me, because that helped me with my time efficiency, and I'll be happy to share those. But I also love questions. This is your opportunity as you listen to my presentation and hear my story to write down your questions. If you are too afraid to ask them, you can also ask them in the chat. I know that I'll be moderating, Jackie and Lakshmi will be moderating the questions, but that's the best way to get information as you're on your journey to decide what you want to do. If you want to go into healthcare, maybe even start thinking about specialties. So that's going to be a really good way. So please ask questions. So let me go ahead and start my presentation here. Okay. Oops. So basically, just going to go over my own story, what pediatrics is, and then we'll have time for questions at the end. That's me. So my name is Yami, like mommy, and I'm actually originally from Panama. I was born in Panama, but I grew up in Texas. And that's where I did all of my education up until residency. I am married. My husband and I just celebrated 20 years of marriage because we're college sweethearts. So we got married very young at the age of 21. And we have 2 sons aged 11 and 16. I do own my own practice and have for the past almost 6 years. And I also host the podcast called Veggie Doctor Radio, which has almost 500,000 downloads. And in 2019, I published a book called A Parent's Guide to Intuitive Eating, How to Raise Kids Who Love to Eat Healthy. And I do a lot of side projects in addition to my career in pediatrics. So like I said, I grew up in Texas, and I grew up in a small town of only about 22,000 people, only one high school. So that's the high school I went to, Huntsville High School. And Lakshmi and Jackie had asked me if I remembered my GPA. I tried to find it. I keep my transcripts, but I could not find my final GPA. But I did graduate 12th in my class, which was pretty good because, like I said, there was only one high school in town. So it was a pretty big class. My high school career was, I think, pretty typical for somebody that wants to go into the health sciences. I took anatomy and physiology, AP chemistry, but I also did lots of things that I was interested in. I was captain of the speech team. I participated in musicals and plays and drama. I did a little bit of traveling abroad, volunteered a little bit, but mostly I just tried to do the best I could in my classes and get good grades and, just have fun. I went to Austin College, which is a small private liberal arts college in Sherman, Texas. That's in North Texas. And there I actually majored in psychology. I also did pre-med in addition to make sure I got all my prerequisites in for medical school. But I did research in psychology and I graduated with honors in psychology because I did research and I graduated magna cum laude. My GPA, I think, was 3.78. That's what I remember, but I might be wrong. Some of the things that I participated in college are Habitat for Humanity, because my boyfriend at the time, who is now my husband, was the president. So we did a lot of activities. We even traveled to Mexico and built a house there. Like I said, did research and some volunteering. Mostly I just studied and had fun with my friends. Most of our friends in college were also either pre-med, pre-dental, a lot of health sciences people. So we were all doing the same thing. I never felt like I missed out on anything. We had a lot of fun. After college, my husband and I both went to the same medical school. So there wasn't a medical school match at the time. There might be now, but we got lucky. We got accepted into the same medical school. And we actually went straight into the DO Master of Public Health combined program. So we started our Master of Public Health 10 days after we got married, 10 days after graduation, because we got married on the day after graduation from college. And we started our educational medical school career then. We went to the University of North Texas Health Science Center, which is in Fort Worth, Texas. I loved medical school. I love learning about all of the different concepts and ideas, and it was just so much fun. It's definitely a lot of hard work. You're studying all the time. It's a full-time job. You should consider it a full-time job, but it was just really great. And I graduated with 3 degrees, my Doctor of Osteopathic Medicine, Master of Public Health, and Master of Science and Clinical Research Education. And I did that in 5 years. So I took an extra year to finish the other 2 masters and graduate with all 3 degrees. The coolest thing about that is I got to be the last person to walk across the stage, because at my medical school, the way they did it is everybody graduated under their school that they were in. But since I was in like 3 different schools of education, I got to be the last one to walk across the stage and get my degrees, which is really cool. But I can't neglect to say that I also had my first son in medical school. I always forget to give credit to my poor kiddos, but he was born between the 4th and the 5th year of medical school. And when we graduated from medical school, he was a little over a year old, like 14 months old. And then we headed to Cincinnati to do residency. And I did my pediatrics residency at Cincinnati Children's Medical Center, which is in the top 5 residency programs in the country, top 5 children's hospitals in the country. And what's really cool about Cincinnati Children's Medical Center is that they have a primary care track. So one thing that you all should know is that I actually applied for and was granted a scholarship to pay for my medical school. And it was something that I had to apply for in college. So I applied right after I knew I had gotten into medical school in January of my senior year of college, and I was granted this scholarship. It's called the National Health Service Corps Scholarship. They pay for your entire medical school education. They also give you a monthly stipend to live on. And then when you're done with your training, with your years of education, you owe that much time in an underserved area. So that obligates you to stay in primary care. And primary care includes pediatrics, internal medicine, obstetrics and gynecology. And at the time, they would also considered general psychiatry within that. And so you would stay in those specialties without subspecializing, but I'll tell you more about that in a little bit. So I knew from the beginning I wanted to do primary care. My inspiration had been my aunt. And because of that, I felt very confident that I could do this scholarship, and I was granted this scholarship. And because I knew I was going to do primary care, when I went to Cincinnati Children's Medical Center, I asked to be in the primary care track, which gives you more time in the outpatient setting so that you can learn how to do that. And I thought that was a great decision for me. So speaking of my aunt Nilsa Martinez, she was a general practitioner in Panama. And when I was little, I really admired her. I watched her treat patients in the living room of my grandmother's house. Even after I left Panama to start my education here in the United States, I would go back to Panama every summer to spend time with my grandparents and my family. So I would be there all summer for 3 months, and I would get to watch my aunt treat patients, and I loved it. So she was a general practitioner. She wasn't specialized. She just saw anybody. But a lot of the people that she saw were older people and geriatric age people. And what I remember most about her was that she was very patient. She was very loving and compassionate. And she always had time, no matter what, even if it was in the evening and she was tired, she always gave away her time to make people feel better. And I admired that so much. And I wanted to be just like her. So I had my sights set on medicine since the age of 4. And I was very laser focused on that. I didn't let anything stop me. Even when I got discouraged, I kept taking steps towards becoming a physician. I didn't know I wanted to be a pediatrician from the beginning, though. I just knew I wanted to be a doctor. I thought probably family practice. There was a time I thought maybe psychiatry, but I did not know I wanted to be a pediatrician yet. So let me tell you more about pediatrics and why I chose pediatrics. So pediatrics is a specialty. It is just a specialty of medicine. So there's lots of different specialties. Pediatrics is a specialty that you treat children from birth until age 21 in general. That's what pediatrics is. So they are physicians just like any other physician, but all physicians have some sort of specialty for the most part. There are doctors that may only do a 1-year internship. And so they're called general practitioners. They are not specialists. A family practice doctor is actually considered a specialist. A pediatrician is considered a specialist. An internal medicine doctor is considered a specialist. An obstetrics gynecologist is considered a specialist. So from the specialty of pediatrics, you can also subspecialize. So say pediatric cardiologist, that is a doctor that specializes in the heart and the cardiovascular system of children. So that's called a subspecialty. And even from there, there's subspecialties. It can get even more specific than that. There's some people that do work only in the electricity of the heart. So these are pediatric electrophysiologists. So they go into pediatric cardiology, but then they do even more training specifically on the electricity of the heart. It can get very, 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 very sub specialized. Same thing with surgery. So you could be a general surgeon, which is a specialty, or you can be a hand surgeon, which is a subspecialty, okay? So pediatrics in general is a specialty of medicine that cares for children from birth to age 21. So that being said, we do a lot of things. We take care of anything that happens to a child, from prevention, which a lot of that has to do with vaccines, making sure that children are growing properly, making sure that they have proper nutrition and development, all of those things, to when kids get sick. So kids get sick from stuff that you all have experienced: colds, flus, ear infections, those kinds of things. But kids can also get very, very sick. So kids can get cancer, they can have genetic disorders, they can have rare conditions. there's kids that require very intensive care because they have chronic complex conditions like genetic disorders where they have to have G tubes and breathing tubes and all kinds of things like that. And then of course you can have a child that's perfectly healthy and they just come in for their well child checks and you just make sure they're growing and doing all the things that they need to do to have a long, healthy life. So pediatricians can do a lot of different things. You can stay more generalized in primary care pediatrics, which is what I do, or you can subspecialize or you can subspecialize. So I am a primary care pediatrician. A lot of you have probably seen a primary care pediatrician. That's the doctor that you go to for your well child checks and who sees you for your throat infections and your ear infections. So we take care of kids on a general basis. And then if we need more help, like say I have a kid that I can't figure out why they're fainting and I've done a workup and I think maybe it's a cardiovascular issue, I refer them to a pediatric cardiologist. Okay, so that is how primary care physicians work with subspecialists. We usually refer when it feels like it's out of our scope of expertise and familiarity and experience to doctors who are subspecialized, and that's all they do all day. Okay. What is my day like? Well, I own my own practice, which means I have a lot of control over my schedule, which is one of the reasons I own my own practice. I love being in control of my schedule. Because I do lots of other things outside of medicine, which I'll talk about a little bit more in a little bit, I see patients generally on my long days from 8:30 in the morning to 5:30 in the afternoon on Mondays and Wednesdays. Fridays, I have a short day because I love getting done early on Friday. Who doesn't? Who doesn't love to be done early so you can start your weekend early? So I'm usually out of the office by 2 p.m. on Friday. On Tuesday, currently, I'm doing telemedicine from home, and that's my podcasting day. But soon I'll be adding in another Friday morning clinic, like kind of like Friday, or Tuesday morning clinic like Friday, where I see patients from 8:30 to about lunchtime. So when I go into work, I have my patients are already scheduled. I'm usually pretty full. I might have a block or two for a patient that calls that same day that needs to be seen to check their lungs or check their ears or something that happened. Kids get injured all the time. They're always falling and hurting themselves. So it's nice to have little open blocks where you can squeeze people in during the day as they call. Right now, I'm very, very busy. So I'm seeing about 22 patients a day, but I like to keep it between 14 and 18 just so that I can have time to talk to families and do my charting and all of that. For the most part, what I'm doing most of the day is well child check. So I am seeing healthy kids from birth, from little babies that just got out of the hospital from being born to teenagers. And I'm asking them about their diet. I'm asking them about their exercise and their sleep, weighing and measuring them, getting them up to date on their shots, all of that. I have a very unique practice. I don't have a nurse or a medical assistant right now. So I do all of the vitals and I give all of the shots, any procedures that need to be done, I do them myself. I just have an office manager that checks in patients, cleans rooms, takes phone calls, all of that. So it's not your typical office where you see like a bunch of people running around. It's just me and the office manager. And that's why I like to keep my numbers low, because otherwise it's kind of impossible to get everything done. Other tasks that I do are taking phone calls from families that just, they want to run something by me. A lot of parents call and ask, is this something that needs to be seen? Should I come in, or can you give me some advice over the phone? So I do things like that, sign paperwork. You have probably had a doctor that needed to sign a school form or a camp form. I do things like that. I send prescriptions into the pharmacy. Usually that's done electronically. Sometimes we have to call the pharmacy and call it in if, there's an issue with that. I call subspecialists. So if I have a patient that I'm not sure what's going on, or I just need to run something by a subspecialist, I will call a subspecialist and say, hey, this is what's going on with my patient. This is the issues that they're having. what would you do next? Or should I send them to you to see them? So it can be a very intense day. It's very busy. There's stuff going on all the time. And I think if you're somebody that hates to be interrupted and needs to stay ultra focused all the time, do not go into primary care, because the epitome of being interrupted is primary care medicine. Okay. You're being interrupted all day. There's things coming at you. There's phone calls. People need things. But at the end of the day, I love my job. I love seeing the babies, and I love being with the parents and supporting them. So that's what a usual day looks like for me. At the end of the day, I try to have all my notes finished before I come home. But if not, I might take like half an hour at home to finish all my notes and my charting and submit my billing, because you want to make sure that you keep up with all your documentation as a physician. That's a very important part of being a doctor. So I told you that I wasn't thinking that I was going to be a pediatrician when I first went into medicine. I thought it was going to be family practice or maybe psychiatry, because I was a psychology major and I just love psychopathology, and talking about it is fascinating, so fascinating. But when I went into medical school, my psychiatry rotation, I decided, nope, that's definitely not what I want to do for the rest of my life. And I actually had chosen to go into family practice and later get a fellowship in geriatrics, because you can get a fellowship in geriatrics through either family practice or internal medicine. So geriatrics is a subspecialty where you deal or you treat and you serve only very old people. So it's the opposite of pediatrics. I thought I was going to go into geriatrics. I had a mentor in geriatrics. I had done research in geriatrics when I was in medical school. I love geriatrics. It's a beautiful profession. And I think mostly geriatrics, you're dealing with people 80 and above. So older people in their hundreds. I mean, it's amazing. I really loved it. So I left my pediatrics rotation for very last, because I was sure that I was not going to be a pediatrician. I grew up as an only child. I didn't really babysit. I wasn't around lots of little kids growing up. So I thought, no, I don't think that's for me. And when I did my pediatrics rotation, after the first week, I just knew it was for me. And I came home and I told my husband, I said to him, I really like this. And he's like, oh, good. I'm glad you like it, because, he was worried I was just going to hate the rotation. It was going to be awful. And I'm like, no, I really like it. And then I ended up changing my path and decided to go into pediatrics. Why do I love pediatrics? Well, kids are super cute. Babies are adorable. And I just love them. And especially preschoolers, when they're getting to like 4 or 5 years old, they're just the coolest kids ever. They're hilarious. They're so funny. And I just love being around children. And even when kids are sick, they still have this light about them. And it's just so easy to be around them. And it just feels lighthearted and it feels fun. And that's my personality. I just didn't realize that until I tried it. So that's why you have to go into everything with an open mind. Also, the other thing I love about pediatrics is I love supporting parents. Whenever you're a pediatrician, even though your patient is the child, you're actually communicating and giving education and information to the parent. Excuse me, I can't mute myself while I'm sharing. So who you're serving is the parent. You're talking to them, you're giving them education, you're guiding them. And so you really have to like giving education, answering questions, and all of that if you're a pediatrician. And then also, like I said, I knew I had to stay in primary care. And so it was going to be primary care pediatrics once I decided. What's the difference between treating children and treating adults? There are several differences. You've probably heard that children are not just little adults. We do a lot of math in pediatrics, so I'm very grateful for a calculator, because I am horrible at mental math. And I usually double and triple check my math to make sure that I'm doing it right. Because in pediatrics, we calculate doses based on weight, which is not typical in adult medicine. So that's a big difference right there, because as children grow, they have different weights. So you're always having to calculate their doses. There's also some conditions that are more common in children than in adults. And there's some conditions that don't exist at all in adults. And so adults wouldn't even know about it. As pediatricians, we have to be on the lookout for genetic chromosomal things that we are able to detect early, metabolic conditions, things like that. There's a lot of things that adult doctors have never heard of because they've never seen it, because some children, if they get certain conditions, they may not even make it to adulthood. So it is very different. And like I said, it's just really fun. It's lighthearted. Kids want to have fun. They like joking around with you. They smile, they're silly. They come in dressed like princesses and unicorns and superheroes. And it's really, really fun. It doesn't feel as serious or as intense as adult medicine. In adult medicine, I felt like all day I had to kind of like be very serious. And in pediatrics, I'm laughing, I'm giggling, I'm joking around all day long. And I love being in that state of mind. So before I leave time for questions, I think we're nearly there. There's a couple of pieces of advice that I want to give you. One of them is never give up on following your dreams, because it can be achieved no matter who you are. You can definitely achieve it. Becoming a doctor is a long road. It's going to take persistence. It's going to take patience. It's going to take really that drive and that light inside of you to want to do it. That being said, it's very important that you want to do it, that you have your own reasons. So if you're not sure, maybe start writing about it. Why do I think I might want to be a doctor? What lights me up about that? If you feel that all your reasons are because, oh, my mom and dad want me to be a doctor, my grandmother wants me to be a doctor, everybody thinks doctors are cool, those are not good enough reasons. You have to have something inside of you that makes you want to be a doctor, because there's going to be times when it's going to suck. It's going to be hard. Everybody's going to be out doing stuff and you're going to be studying. All of your friends are going to have jobs. They're going to be making money and you're not going to be making money. You're in fact going to be taking out loans to go to medical school. So you really have to want to do it. In addition, don't give up on your interests and your passions. There's going to be times when you really do have to hyper focus on medicine. Definitely. There's going to be times where you're studying for exams and you can only think about live, breathe, everything in your life is studying, but that's not all the time. And I wish I would have remembered that earlier in my life. So if you like kayaking, leave time for kayaking. If you just love going to rollerblade, or if you love watching movies, or if you like reading novels, whatever it is, make sure that you leave some time in your life to pursue your interests starting now. Don't be only doing things for medicine. You have plenty of time to focus on medicine. You're going to have the whole rest of your life to do your career. Don't neglect that side of you that wants to do other things that light you up. For me, it was acting, doing those things. And now it's something that now that I'm this far in life, I'm having to re-pursue again, because I neglected those interests for a long time. So do what makes you happy, do what you want to do, not what other people want you to do. The second piece of advice is be careful with your money. A lot of people are under the impression that it doesn't matter how much debt you have, because when you're a doctor, you're just going to make $1 billion and you're going to be able to pay it off. That is not a good attitude to have, because you can end up in a situation where your money problems and your debt is trapping you and it's limiting your freedom. So be frugal from the beginning. It will pay off, I promise. Don't take out more than you need for your education. If you can get a job now and start saving up, whatever it is that you can during high school and college to save up and supplement your loans, whether it's for your living costs or for your food or whatever, do it, because it really does help that whenever you get out of your medical education, you don't feel so suffocated and burdened by your debt that it limits your choice in what kind of job you want to have. Because we had more freedom with our finances, I was able to take the leap and start my own practice. Otherwise, I never would have, because I would have been too afraid that I wouldn't make enough money to pay back on my loans, or that, we wouldn't make enough money to pay our loans and live. So think about it long term, live frugally. I love Dave Ramsey and those kinds of programs that really help you think about how to manage your money so that in the future you have more freedom, because less debt equals more freedom. And then it will pay off, and you'll be able to get your fancy car. And if you want a fancy house, whatever it is you value, you'll be able to get that. But if you get yourself in too much debt at the beginning, it can be paralyzing. So that is all that I have. But real quick, I just want to tell you that besides being a doctor and seeing children in my practice, I also do a lot of things on the side. So like you heard at the beginning, I wrote a book in 2019. I have a podcast that's almost 4 years old, almost 500,000 downloads. I am very active on social media. I'm very active on Clubhouse, Instagram and Clubhouse and those kinds of places. And I love to participate in all that. So don't feel like you aren't able to have multiple facets of your career. Whenever you become a doctor, you can do all the other things that you love to do. So if you want to follow me on Instagram, I would appreciate it, at the Dr. Yami. And if you want to find out more about my practice, you can go to dryami.com and it'll branch out to my other websites, veggiefitkids.com, which is the website that I made to support plant-based kids and families that want to raise plant-based and vegan kids. That was one of my first projects. And then my practice website, which my practice is called Nourish Wellness, here in Yakima, Washington. And so now it is time for questions.
Okay, so thank you so much, Dr. Yami. That was a great presentation. Now we're moving on to the Q&A session. So if you have any questions, feel free to either use the chat, private message me, or raise your hand and we will call on you. But yeah, so if you have any questions, just leave them in the chat or just raise your hand. And Dr. Yemi, would you prefer to have me like read the questions out loud, or do you just want to read it yourself?
I don't mind reading them. I don't see any yet though.
Okay, yeah, so I have two already
Okay.
that they private messaged me. So
Okay.
First one is, what activities or extracurriculars should high schoolers do if they are interested in pursuing a pediatric career?
Well, if you want to go into pediatrics specifically and you want more exposure, then find a pediatrician in your community and ask if you can job shadow. That's one of the things that you can do at the beginning. And then I would say volunteer. So there's all kinds of places that you can volunteer. Obviously, there's hospitals, but there's also outpatient facilities like physical therapy practices or occupational therapy practices that see children, all of those kinds of things. It's all very important to treating kids. I know that right now we're kind of in a weird time because of COVID, so there might be restrictions, but hopefully once things start opening up, there'll be opportunities that open back up again so that you can get exposure. But I would say that that's the main thing, is get exposure, get familiarity. That'll help you also determine if it's something that you really do enjoy.
Okay, and then next question, have you ever experienced treating a really stubborn child? If so, how would you handle the situation?
Like every day, of course. That's every single toddler on earth. And they peak, as far as stranger anxiety, it peaks at 18 months. They cry as soon as I walk in the room. The entire time they're crying, the entire visit. I have to yell so that the parents can hear me to complete all the questions. And the whole time they're fighting the exam. That's like a very typical 18-month-old. However, the stubbornness, I don't want to point any fingers to y'all, but it comes back in the teenage years. So some teenagers, they're stubborn in a different way. They won't answer any questions, anything I ask them. Sometimes it's like, fine, or whatever. And thankfully, my practice now, I have a very unique practice in that most of my teenagers are super sweet and super nice and very mature. But I've definitely had experiences in the past where it's very, very difficult to get anything out of a teen. So you just know that it's going to take time. You're going to have to build rapport. You're going to have to stay patient, and you're going to have to let them come to you. Just let them know that you're available and come to you. So yeah, it's medicine is not easy. It's fun, and in some ways it can be simple, but that's why it's called the art of medicine, because you have to learn how to navigate all of these things. Each patient's different, each encounter is a little bit different. Parents, parents can be so anxious that it makes you feel anxious, or parents can be in denial. So there's all kinds of situations that you will learn how to navigate with time and experience. But that's a great question.
Okay, and then how long will it take for me to become a general pediatric surgeon?
Ooh. So that's a subspecialty. Okay, so that one's a little bit interesting, okay? So if you want to be a pediatric surgeon, you have to go into surgery first. You don't go into pediatrics first. So your residency is going to be in general surgery, and then you will subspecialize in pediatric surgery. Okay. So you're going to have your 4 years of college, you're going to have your 4 years of medical school. General surgery, I hate to just say this, but general surgery residency is usually 5 years. And then after that, there might be another 2 years. So how you add those up. So I'm very bad at mental math if anybody wants to help me. So 4 years of medical school, 4 years of college, 4 years of medical school, 5 years of general surgery, and then let's just say 2 years for whatever subspecialty you want to be in. So that's a long time. I didn't start working as a primary care pediatrician till I was 30. Thank you, whoever did the math, 15 years. 15 years after high school. But you will make a lot more money than a primary care pediatrician. So if you want to think of it that way, and some people, they're meant to be surgeons. I mean, surgery is a whole different field. I do not love it. I don't like doing procedures. I would be so stressed out if I had to cut people every day. So if you know that you're just like, wow, that's super amazing, that's super interesting, then it may be the field for you. And we need great surgeons. And we especially need good pediatric surgeons, because surgeons in general are known as having like kind of a gruff bedside manner. But whenever you work with kids, you want to be approachable. You want to make kids feel comfortable. You want to make parents feel comfortable. So we need really good people in that field.
Okay, and then Rachel and Mel, you guys have your hands raised. So Rachel can go first, and then Mel after.
Hi. First of all, awesome presentation. I think that we learned so much from this and that it will be very helpful to all of us. But I was wondering about rotations because I noticed that you talked about how you took different rotations like in middle school. I was wondering, how do they work? Like, do you get to experience different specialties in it?
Yes, great question, Rachel. Thanks for asking that. I take a lot of stuff like that for granted because it's just something I know. So you have required rotations because you can't graduate from medical school without meeting certain qualifications. And one of those is that you have to do certain rotations. So you're always, no matter what, you're going to have to do pediatrics in medical school. And I think the minimum, I think, is 8 weeks that you have to be in a pediatric clinic, and you're doing hospital. So you're doing inpatient. When you're in the hospital, it's called inpatient. And when you're out in the community in the clinic, it's called outpatient. So you're doing both inpatient and outpatient pediatrics. You're doing family practice, you're doing surgery. So you have rotations you have to take no matter what in order to meet the specifications to graduate from medical school. And then you're going to get elective rotations. So not everybody's going to do dermatology in medical school, but you might want to do like a little dermatology rotation, or you may want to do an extra pediatrics. Like I did pediatric gastroenterology when I was in medical school. I did neonatology, month in the NICU, and that's an inpatient rotation where babies are only in the intensive care unit for newborns. And then your fourth year, you're going to get a lot more of those electives. And the other thing that you should do in your fourth year of medical school is take electives in places that you think you want to go for residency. Because just like in high school, you're getting ready and you're thinking about going to college. And just like in college, you're thinking about and getting ready to going to medical school. When you're in medical school, you're thinking about and getting ready to go to residency. So before you apply to residencies or during your application, you want to test out those residencies. So you do it by taking an elective. So it meets your requirements for graduation. You get more education experience, but it also lets you see what it would be like to do residency in that place. So that's a great question. And at the beginning, a lot of people don't know what specialty they want to go into. So as they go through their core rotations, the core rotations are the ones that everybody has to take. People either start checking things, taking things off of the list or putting things on the list. There's some people that have a really hard time at the end. They just love everything. Usually the people that love everything, they end up going into family practice because they want to do it all. They want to see kids, they want to see adults, they want to deliver babies, they want to do some surgery. Family practice, they do everything. And there's some people are like, I definitely don't want to do everything. And they start marking things off the list until they get down to narrow it down to a few. Great question.
Okay, Mel, if you have a question, you have your hand raised. You could ask right now.
Okay. Again, just like she said, your presentation was like really inspirational. As someone who wants to be an aspiring pediatric nurse practitioner, and just really opened my eyes to different opportunities. But just out of curiosity, throughout your education, which one was the most difficult or most stressful?
Well, residency is really hard. And I'm so grateful that I went to one of the top pediatric residencies in the country because it does make a difference. I've seen the practice of some other doctors, and I love all my colleagues and I think everybody's great, but I know that I came out very prepared, but it was really hard. And the thing that made it harder for me is we already had a son. So when we started residency, our son was about 15 months old. And my husband and I were both in very intense residencies. We were on call every fourth night. And at that time, rules have changed, but at that time, every fourth night, we were awake for 30 hours straight. My residency was so busy, I wouldn't sleep for 30 hours. So you get in at 6 o'clock in the morning, say on Thursday, and you don't leave till Friday at 1 p.m. So, and then you're awake the whole time. And you do that every fourth night. And then my husband and I had opposite schedules so that there was always somebody that could be home with my son, but we were exhausted. We were like walking zombies, and it's stressful because you're really intensively trying to learn your craft at that time. You're really focusing in, you're honing in. You're still doing rotations in residency, but it is focused on your specialty. Okay. So now everything is pediatrics, but you're doing all kinds of different pediatric things that are essential for you to graduate from residency and be able to take care of kids by yourself. So you're feeling that pressure like, oh my God, I have to learn this. And whenever you very understandably don't know all the things, you get terrified. So you, especially that first year, you're just feel like you're going to vomit all the time, but then it gets better. You get familiarity and, you start feeling more comfortable with the material. And then you learn that even if you don't know everything at the end, you know how to get that information. So by the end, you feel very confident, you're ready to go. But residency is really hard, and it should be. Like, it needs to be intense because when you finish residency, you get a medical license and you take care of people by yourself. And if you don't know your stuff, you could harm somebody. So it's very, very important that it be a very good learning experience. And you should aim to get into the very best program that you can. Okay. Like, aim for the moon and land among the stars. Okay. Like, it's very important that you get into a good program. And don't get lazy about it and be like, oh, I'm going to go to this program because I heard that, they don't make their residents work very hard. That's not the best attitude, because you want to leave that program being able to take care of people the best way possible. But long answer to your question, residency was definitely the most stressful.
Okay, next question. Were there ever any moments where you doubted your ability to become a doctor? And if so, how did you persevere the issues, I guess?
Yeah. So I think the first time was just in college because I'm just going to admit I really did not like organic chemistry. It was so hard. I did fine, but it just it's one of those things that you get into some classes and it just seems really, really hard. And it just kind of knocks down your confidence that you'll be able to do that. Um, but, it ended up being fine. And that was sophomore year of college, which was pretty hard anyway. And everybody's tired and studying all the time. And then I would say that the second time, and it wasn't that I doubted my ability to become a doctor, I started doubting my ability to work that hard. And it was in residency. It was because it's just very extreme. Like your life is extreme like no other time in your whole life. You're working 80 hours a week, And so it's just grueling. And sometimes you just want to give up just because it's hard. It's not that I didn't think I could do it. I knew I could do it, but sometimes you just don't want to do it. You're just like, I just want to sleep for a month straight. That's how you feel. And, they joke about in residency that people are always like fantasizing about, just getting like in a minor car accident or getting just like, not like you're going to die, but getting something just enough to hospitalize you so that you can have some time off. That is the kind of fantasies residents have. I don't want to scare anybody, but it's hard. And so you just have to be mentally prepared and just set your life up in a way that you get the self-care, you get the sleep, you get the nourishment. And that's another point that's important is do the things you love still, because that's going to fuel you and it's going to keep you going. But those are the two times. Medical school, I felt great the whole time. I loved it. But I would say in college and residency, I hit some little stumbling blocks.
Hi, as someone who's wanted to be a pediatrician for like a long time, what classes do you think I should take in high school to become one? Or like, what do you think I can do in general to prepare myself for the future?
Well, like I said, take your classes that you're going to need to get into the best college you can. Everything is you're going to set yourself up. The earlier you know what you want to do, the more prepared you can be for the future. So set yourself up, get into a good college, and college, set yourself up, get into a good medical school, and so forth and so on. However, remember that if you want to be a pediatrician, you're going to go into pediatrics, you're going to have plenty of time to be a pediatrician. So don't neglect your interest. And that's also going to make you an applicant that stands out more. So say you just really love doing international travel or something like that. How can you integrate that into your life that gives you joy, but also makes you more interesting? You know what I'm saying? Like you want to be a person, you want to be an individual. You don't want to just be like this standard application, volunteer to here, volunteer, like everybody's trying to do that. That's fine. But have fun in your life, pursue your interests, delve into them, while at the same time, you're preparing yourself for the next step as best as you can. Get good grades. It doesn't help to do a bunch of stuff if your grades aren't good. You still have to get good grades. Okay. So that's your number one focus. And if that's all you can focus on is getting the good grades, then that's all you can focus on. If you're able to get good grades, but you're able to participate in other things that you enjoy and that you like, then do that, but go towards what you like, because you're going to have plenty of years to be a pediatrician. I promise. Great question.
Thank you. That was a really good answer.
What else? Anybody curious about anything else about medicine in general? My husband's an internal medicine hospitalist. So he's like almost nearly polar opposite of me. He only sees adults that are in the hospital. I only see children in the clinic. So his patients stress me out, and my patients stress him out. When I used to round in the hospital, sometimes they would get us confused because they would have to call down and, admit and be like, it's for Dr. Lancaster. And the person putting the stuff in the computer would put one of my patients under his name, and it would be a newborn because I would only round on newborns, and he would freak out, and I would tell him, babe, don't worry. Newborns are super healthy. It's going to be fine. But when they end up putting like an 85-year-old on my list that has like heart failure and COPD and all this stuff, and I haven't done that in years, I think that's more scary. But yeah, we're polar opposites in our fields of choice.
Sorry, I can't raise my hand. It's because I'm host. But earlier you mentioned that you often refer to subspecialty doctors for your patients, and especially because you own your own practice, I was curious how you were able to get all of those contacts for the subspecialty.
Well, my community is small. I still live in a small community. It's only 100,000. And so you just know, and then you just get familiar with who you like and who you've referred to before and who's taken good care of your patient. So I'll say the most common subspecialists that I refer to are ear, nose, and throat. And that's usually for kids that have recurrent ear infections or have huge tonsils and they're snoring and having sleep apnea. So ear, nose, and throat doctors are surgeons, but they're subspecialized into ear, nose, and throat. And allergists for my kids that need to be allergy tested. We have an allergist here that's both adult and pediatric. So it's not just pediatric specific, but they're able to see my patients for that. And then I refer to, see what else most often, some of the ancillary stuff, which isn't actually, they're not physicians, but like physical therapy, occupational therapy, speech therapy, we're referring to them a lot. And so I just have my people that I know and like and refer to them, and it works out very well. You just get to know. And when you're new in a community, like say you finish residency and you move to a community you've never been before, then you can kind of just ask around, call other clinics and say, hey, you can even just look on who are the ENTs, who are the allergists, who are orthopedic surgery is another one because kids break bones all the time. I don't put casts or anything. So I'm referring to orthopedic surgeons all the time to either put casts or do surgery for broken bones. So you just kind of look and see who's in your community and start to get to know people and refer to them. And once you refer to them, you get notes back and the families will tell you, oh, I really like that doctor. Thank you for referring me to that doctor. Or they'll be like, yeah, that wasn't a good experience. And then you know that you probably shouldn't refer to that person in the future.
Thank you.
You're welcome. Anything else?
Okay, so I guess if no one has any other questions, I have a question. So like, I know you mentioned you got like a scholarship. So what was the scholarship exactly, and like how did you receive it?
So it's called the National Health Service Corps Scholarship. And I'm not sure if they're doing it exactly the same anymore because you can do it two ways. You can do it so that you apply ahead of time and they pay for your medical school and give you a living stipend and then you owe time. Or you can apply for it after you're already working as a doctor and they just help pay off your loans. Some people prefer the second option because they don't want to be committed ahead of time to know that they have to go into primary care and default on their commitment because that's not a good thing. You end up having to pay a lot more money that way. So I found out about the scholarship. I don't even know how I found out about it, but I found out about it in college and I applied, and it was an interview process just like to get into medical school. And you have to do all these forms and, fill out an application. It was a pretty intensive interview process, but I got it granted. My husband applied too, and he didn't get it, which is probably a good thing because he ended up being a hospitalist, and it doesn't count if you're a hospitalist. You have to be an outpatient primary care doctor. So it ended up working out for the best. And so I knew before I got into medical school that I was going to have that scholarship, but there's all kinds of other scholarships. And if you, like I said, the money thing I think is really important in order to have more freedom later. So look for scholarships. They have all kinds of stuff. But even if you don't get a scholarship beforehand, if you serve in an underserved community, often you can get your loans repaid if you are in a community that doesn't have enough doctors. So that's always an option later too, because we know that doctors usually graduate with a lot of debt for their medical school training. So there's ways that you can get those forgiven or paid off with assistance if you choose to give some time. And I knew that I wanted to go into community that I didn't just leave afterwards, because a lot of National Service Corps scholars do that. So we picked a community that I felt like we would want to stay long term. And so I've been, the community that I came to after residency is the same one that I'm at now. And we've been here for 12 years now.
Okay, great. So it's currently four or like one for those of you on the West Coast. But yeah, so it's 4 right now. So we're going to just end it off here. But before that, there is a feedback form that we'd like you guys to fill out just for like feedback and just stuff like that. So I'm going to put it in the chat for those of you that do want to fill it out. Yeah.
All right, so to learn a little bit more about your life and your career. Personally, I related to the story of your aunt being your inspiration because my grandparents and parents also played that same role in my own life. And your advice about like pursuing a doctor and like making sure to live frugally, as well as like hearing about your day-to-day life, was really helpful and super interesting. And for all the attendees, thanks for attending, and we hope to see you in future webinars.
Thank you very much. It was
Thank you, Dr. Lee.
fun.